Hi, I'm Dr. John Shim, and today I want to play the role of a patient. The truth is, doctors and doctors' families have the same medical complaints like everyone else. On a weekly basis, I have family members or friends approach me about spinal issues, and inevitably, some have been given the status of candidate for surgery. But what does that exactly mean? How would I, as a spinal specialist, approach that status for either myself or my family? This might be a complicated discussion, but I want to try to let the audience, the viewers, understand my thought processes on how I, as a spinal specialist and a spinal surgeon, would decide major medical decisions for myself, my family, or my closest friends. First of all, if you have a life-threatening or limb-threatening problem, get yourself to an emergency room and call your doctor. Now is not the time to be surfing the web or calling around for information. Full stop, go, call your doctor, go to the emergency room, do it now. For the rest of the viewers, let me tell you how I will make the decisions for myself or how I would advise my family members. I always start with this question: what makes me a candidate for surgery? Understand the term candidate is often used when a patient has some complaints and some testing results that indicate a surgery might be performed or may be performed. It really doesn't define anything more. It doesn't mean you need the surgery or that the surgery will always be beneficial. To give you some examples, it's an accepted principle that up to 80% of people will have significant episodes of spine pain sometime in their life. After age 40, about half the population has MRI findings that can make them the quote candidate for surgery. In reality, less than 1% of the US population has surgery each year. So, for me and my family, elective spinal surgery has always been a very difficult choice. For me, I need to determine if the complaints matched my physical exam findings. I need to know and confirm that the diagnostic testing identified are also consistent with my complaints. Then I need to be convinced that I exhausted all non-surgical options. The final and most difficult part is to basically guess how many other factors have contributed to my complaints, and would those factors diminish the chance of a successful outcome. I need to know what would be the best case scenario after surgery, and I need to know what is considered success for the recommended operation. If I decided to pursue surgery, I have to also understand that the benefits would outweigh any potential risks. These are very hard things for anyone in pain to truly assess. I need to understand if my goals as a patient was actually the same goal as the surgeon. It may seem very strange, but many times the goals may be different. If my goal was to be active, but I define active as being able to do things like when I was 25, I'm going to be very disappointed. I will be 58 this year. I cannot expect that the operation will allow me to act like I'm 25. If the goal of the surgeon was to fuse my spine, and it fuses, then the surgeon achieved his goals. But if my goal was to be pain-free, and my goal was not to have any discomfort, then my goal may be disconnected from the goal of the surgeon. The surgeon may say he did a successful fusion, but I'm going to complain that I'm not really pain-free, so there'll be dissatisfaction. When I'm in pain, I really also cannot assess the risks properly. Let's be totally frank. The larger spinal operations have the higher complication rates and a smaller chance of success. Even the smaller operations cannot be a 100% guarantee. If I'm going to consider surgery, I have to ask myself, do I understand the risks, and am I prepared to accept complications? Am I prepared to be even worse after the operation? While I need to be confident things will improve, I must also accept that there is a possibility it may not turn out that way. That's why, if I was going to have surgery, I will do everything else first before deciding to have an operation. I will have a deep conversation with myself before committing to the operation. I really need to take desperation out of the decision process. I know This is all very hard. But in the end, I'm the one getting the operation. I must be confident the diagnosis is right. I must be certain that the surgical procedure is the best for my situation, and I must be also confident that I've tried everything else. I must also understand that I have to be realistic with my goals, and I need to accept that there are complications or potential that the outcome may not be as good as I thought. I need to understand that this is an exercise of what's called risk management. You have to weigh the benefits to the potential risks. This is a discussion of transparency. If I'm the patient, I have to be transparent with myself. I need to understand what I'm trying to achieve, and I need to understand if it's realistic and can the surgeon get me a reasonable chance to get to that goal. I have to have a long discussion with myself and my family before I pursue the surgery, because it's very, very important that we all understand it. I hope I didn't scare anyone from making the decision to have surgery. I just wanted to share what I would do if I had to make a surgical decision for myself or my family. This is Dr. John Shim discussing how I would approach surgical decisions for myself or my family. Thank you for listening.